Hi, I'm Dr. Laurel Griffin with Precision Chiropractic West in West Des Moines, Iowa. Today I'd like to talk about headaches of all kinds: pressure headaches, tension headaches, sinus headaches, migraine headaches. Here at my office, we often find a common denominator when it comes to headache patients and treatment of them. Usually what we'll find is a complex misalignment at the very top of the neck. The atlas bone has shifted into a position that it shouldn't be in. We call that cranial cervical dysfunction or cranial cervical syndrome. What actually will happen there is that the top bone, the atlas bone, will slide into a position where it can affect the blood flow to the head. The vertebral artery can be diverted and actually compress into the brainstem in some cases, and that will affect the pressure of blood flow to the head, which can cause migraine headaches, multiple other types of headaches. In addition to that, the rotational misalignment of the atlas bone and the C2 bone below it can actually pull caudally, inferiorly down towards the feet on the contents of the cranium, meaning that part of the actual cerebellum, part of the brain, can be pulled downward a few millimeters into the opening of the base of the skull. That can actually cork the opening of the base of the skull or the foramen magnum and affect how the cerebral spinal fluid flows to and from the head. Now, the cerebral spinal fluid is actually the fluid that flows around the brain and in the brain. It's produced in the brain and actually keeps the brain buoyant. The brain kind of floats in the cerebral spinal fluid within the cranium, and it allows for flushing of the toxins within the brain, waste products. So if you're having a restriction of cerebral spinal fluid to and from the cranium, you're going to have a change in flow dynamics, which can cause headaches, but also it's going to prevent the brain from being able to flush out toxins and heal properly. So what we do here is look for those dysfunctions, those misalignments that could be causing those particular symptoms, and we're going to very carefully identify those misalignments, make sure that it is safe to be working to correct those misalignments at the top of the neck there. And we use a technique called Atlas Orthogonality to make those corrections. There's absolutely no twisting or popping involved in the work that we do. What we do is a lot more advanced technically than that type of approach. So we're going to actually measure the shapes and angles of the joints and the angles and degree of misalignment on every patient, so we know not only that it's misaligned, but exactly how it's misaligned. And then we know exactly how we're going to approach the correction, the vectored correction. And we make the correction within the normal range of motion of the joint. And that's what I mean by no twisting or popping. We don't cavitate the joint or rotate at all. So it's a very gentle, very precise correction that can achieve great results for most patients. So we're able to correct the misalignment that is causing headaches for the majority of patients. And I will never say 100%. Any doctor that tells you 100% that they can fix you 100%, don't listen to them. Nobody can fix everything 100% because there's different causes for every symptom. But I will say that the majority of patients that come to us with headache as their main symptom or neck pain as their main symptom, they have cranial cervical dysfunction, misalignment at the atlas bone, and we are able to help them with it. So if that's you, give us a call. Linda, my assistant, will get you set up in the initial screening process, and we'll see if we can make a difference for you. Thanks. Bye.